Hello everyone, welcome to sqadia.com. I'm your presenter Sananu Rahman, and today the topic of my presentation is limbs. This is the first section of this presentation, and in this section we'll be talking about the embryonic origin of the limbs. This section is further subdivided into an introduction, the embryological development, and hand and foot development. So let's just dive into this section. So first of all, the skeleton is divided into two components, the axial skeleton and the appendicular skeleton. Let's take a look at the further components of the axial skeleton. The axial skeleton consists of skull, the vertebral column, the ribs, and the sternum. So now the other partition, the other differentiation, the other segment, the other part of the skeleton is the appendicular skeleton. The appendicular skeleton also has four subcomponents: the upper limb, the shoulder girdle, the lower limb, and the pelvic girdle. So in lay terms, the skeleton can be divided into a central skeleton, which is the axial skeleton, the skeleton of the central body, and the appendicular skeleton, the skeleton of the appendages, or the skeleton of the limbs. The skeleton of the axial system or the central system consists of bones which help in the formation of the central body. These are the skull, the vertebral column, the ribs, and the sternum. The bones that help in the formation of limbs form the appendicular skeleton. These are the bones of the upper limb, bones of the shoulder girdle, bones of the lower limb, and bones of the pelvic girdle. So let's take a look at the embryological origin of the skeleton. It appears by the end of 4th week of development. There are outpocketings from the ventrolateral body wall. So the upper limb bud precedes the lower limb bud by 1 to 2 days. So the upper limb is forward in development as compared to the lower limb. It consists of a mesenchymal core. Here you can see it's a mesenchymal core that arises from the parietal layer of the lateral plate mesoderm. This mesenchymal core arises from the parietal layer of the lateral plate mesoderm. So the core forms bones and the connective tissues of the limbs. It forms the bones and the connective tissue of the limbs. It is covered by a layer of cuboidal ectoderm. A cuboidal ectoderm covers it. The ectoderm at the distal border of the limb thickens to form apical ectodermal ridge. So this ectoderm at the distal border thickens to form the apical ectodermal ridge, which is acronymed as AER. Apical ectodermal ridge induces the nearby mesoderm to remain as population of undifferentiated cells. This is the population of undifferentiated cells in the nearby mesoderm. This is under the influence of apical ectodermal ridge and helps in the progress of this limb, but it provides a population of undifferentiated cells. So, apical ectodermal ridge induces the nearby mesoderm to remain as a population of undifferentiated cells. As the limb grows, cells furthest from the apical ectodermal ridge form cartilage and bone. Here you can see the limb is growing. This is the progress zone. So the cells which are further from the progress zone, they tend to form the cartilage and the bone. So limb development, the bones are, we have three subsegments. We have stylopods, which are the humerus and femur. We have the zeugopods, which are the radius and ulna, and the tibia and the fibula. And we have the autopods, which are the carpals, metacarpals, digits, and tarsals, metatarsals, and digits. So the bones are formed according to three sub-segments. We have the stylopod, the zeugopod, and the autopod. You can also divide them as the bones of hind arm or hind limb, the forelimb, and the digits or the hands or feet. So the stylopod consists of the major central bone, which is humerus in case of upper limb, and femur in case of the lower limb. The zygopod includes ulna and radius, the bones of the forearm in the upper limb, and the bone of the lower leg, which are the tibia and the fibula. And autopods, which are the bones of the hands and feet, they consist of the carpals, which forms the wrist, then the metacarpals, the hands, and then the digits, the fingers. Similarly, tarsals are the bones of the ankle, the metatarsals which form the feet, and the digits which form the toes. Now, hand and foot development. It starts by 6th week. Terminal portions of the limb bud tend to flatten. Here you can see the flattening of the terminal portion of the limb buds. Here the terminal portions of the limb buds are starting to flatten. This tends to occur by the end of 6th week. Separated from proximal part by a circular constriction. A circular constriction appears at the level of future wrist, which separates this hand or foot bud from this the proximal part of the limb bud. It forms a hand or a foot plate. This is a hand plate. So constriction divides the proximal portion into 2 segments. This constriction now divides the proximal portion into 2 segments. Cell death in the AER apical ectodermal ridge causes the ridge to divide into 5 parts, forming the fingers or toes. So cell death occurs in the clefts between the fingers, and it causes the ridge, the apical ectodermal ridge, to divide into 5 parts, 5 separate parts which differentiate or will develop into adult fingers or toes. So the further development of digits continues under the influence of the ridge ectoderm segments. So these individual segments have been formed, and now these individual segments, they influence the growth of digits. The mesoderm condenses to form the cartilaginous digital rays. The mesoderm, which was in these digits, now it condenses to form the cartilaginous digital rays. Death of the intervening tissue between the rays occur. Development of upper limb and lower limb is similar, except that the lower limb's morphogenesis lags behind approximately 1 to 2 days. We talked about this earlier. The upper limb bud appeared 1 to 2 days earlier as compared to the lower limb bud. Similarly, the morphogenesis of the lower limb is 1 to 2 days lagging as compared to the upper limb. However, they are as similar as one can be. So now we have the rotation of limbs. So now during the 7th week, the limbs tend to rotate in the opposite direction, almost at this stage. This is 7.5 weeks. At this stage, the limbs tend to rotate in the opposite direction. Upper limb rotates 90 degrees laterally. Laterally is away from the central body axis. So upper limb rotates at a 90-degree angle laterally. It causes the extensors to lie on the posterior and the lateral surfaces, and thumbs lie laterally. It causes the extensors to lie on the posterior and the lateral surfaces. Obviously, the extensor muscles of the upper limb lie on the posterior and the lateral surfaces, and the thumbs are now pointing laterally. Lower limb rotates 90 degrees medially. So we have opposite rotation of the limbs. The upper limb rotated 90 degrees laterally. However, the lower limb rotated 90 degrees medially. The extensor muscles lie anteriorly and big toe is medial. As it's very obvious, the extensor muscles now are lying anteriorly and the big toe is lying medially. So now let's talk about the cartilage formation. The mesenchyme within the limb bud begins to condense. So the limb bud, which initially had a mesenchymal core, it begins to condense. the cells now form the chondrocytes. These cells are now being differentiated into chondrocytes. By 6th week of development, the first cartilaginous model, which foreshadows the bone of extremities, has been formed. So a cartilaginous model of the adult bones has been formed by the end of 6th week. So joint formation, how does that take place? Joints are formed in the cartilaginous condensations when chondrogenesis is arrested. So chondrogenesis is arrested in cartilaginous condensations, and this results in the formation of joints. A joint interzone is introduced. Now the joint cavity is formed by cell death. The surrounding cells differentiate into the joint capsule. So here you can see in the figure, this is the joint site determination. There's interzone formation and chondrocyte. This is the interzone. These are the active chondrocytes. This is the chondrogenesis has been arrested and an interzone is formed. Now a cavity has been formed here. This cavity has been separated. The morphogenesis takes place. The cells around this cavity tend to die and form the joint cavity. So now the surrounding cells have been differentiated into a joint capsule, and an adult joint has been formed. So in this section we talked about how the skeletal system originates, what are the major components of the skeletal system, how the cartilaginous model is formed, how joints and cartilages are formed, how the limb buds are formed, how the elongation of limb buds takes place, and how the rotation of limb buds causes the limbs to attain their adult positions. These are very important slides, very important facts that you should know for your examination and your clinical correlates, which would be discussed at the end of this presentation. For those, keep watching sqadia.com.